The definition of ADHD by the American Psychiatric Association is a persistent pattern of inattention and/or hyperactive impulsivity that is more frequent and severe than is typically observed in individuals at a comparable level of development. But remember, within special education, just because you have a medical diagnosis or a doctor's note, if you will, it doesn't necessarily mean you're going to qualify for special education services. A student who has ADHD doesn't have a separate category or separate label within the 13 defined categories under IDEA. ADHD is going to fall under either other health impairment or potentially a 504 plan if they don't qualify for special education services. So ADHD is tricky because it doesn't necessarily always mean you're going to receive services. There has to be educational impact as well as an ADHD diagnosis from a medical professional. ADHD is not a new phenomenon. It has just been redefined over the years. It came to the attention of the medical profession as early as 1902, and the first physician to even acknowledge it was George Still, and he talked about it as a defective moral conduct or control. And later on, Warner and Strauss were able to identify children who were hyperactive and distractible, and those children came to be known as have the Strauss syndrome. As we moved through history, the middle of the 20th century, the term minimal brain injury was used to refer to children who had normal intelligence but were inattentive, impulsive, and hyperactive. Eventually that fell out of favor, as you can probably imagine, and was replaced with hyperactive child syndrome. Eventually this was also rejected, and it was finally recognized for what it is today, which is attention deficit hyperactivity disorder. So over the years, the category of students with ADHD has actually, under other health impairment, actually decreased in size. But the prevalence of children who are reportedly experiencing ADHD and receiving services are 3 to 5% of school-aged children. It's also believed that fewer than half of all students with ADHD are even receiving special education services. There has been a lot of research in recent years which identifies some hereditary components, and we'll talk about that in a second, but you will see also that boys are more likely than girls to receive a diagnosis of ADHD. There are a number of suspected causes of ADHD. One is the neurological dysfunction. Going back to Strauss, believe that there was something neurologically different or wrong about the brain and the brain chemistry. Hereditary factors, we do know from the research that ADHD is a genetic, or tends to have a genetic component. So frequently you'll see where a sibling has ADHD, someone else in the family will have ADD, or a parent will have a combined type as well. And then environmental factors, whether it's pre, peri, or post natal trauma, whether that's in utero or after the child is born. There is a video that I referenced about the brain differences in children with ADHD, and all of those videos are listed in Canvas, so you can click on those individually as I kind of reference them on each of these slides. The newest DSM has 3 categories of ADHD. One is ADHD predominantly inattentive, one is predominantly hyperactive impulsive, and one is a combined type where you have both components. And so you can see kind of the characteristics of students with each of these different components and areas. Everything from the inattention, like making careless mistakes, having difficulty organizing, to the hyperactivity, which is the moving excessively, that restlessness, that being on the go type of activity, as well as impulsivity, having difficulty waiting turn, sharing, interrupting. When you talk about ADHD, there's another of components that come into play. One is the behavioral inhibition, and executive functioning. Students with ADHD have difficulty self-regulating. They have difficulty with that kind of inner talk that a lot of us have when we are trying to work through a situation or decide whether or not we want to say something to somebody. Students with ADHD don't have that ability or don't have as strong of an ability to be able to do that. And part of that executive functioning is also doing the planning that's necessary to make a decision. So thinking through the cause and effect, planning out how to go about tackling a project or initiating a conversation. All those components are missing for students with ADHD. And in relationship to that, that also ties into the social and emotional pieces, where they have difficulty making friendships because they don't have the planning skills. They also don't read the social cues like everyone else does, so they don't always know what others are thinking based on their facial expressions or those nonverbals that others exhibit. Often ADHD exists with other disability areas, so sometimes students have ADHD as well as a learning disability, or they may fall under the category of emotional behavioral disability. So it typically doesn't stand alone. Assessing a student with ADHD really does take a lot of different professionals to make the determination that a student does have ADHD. It starts frequently with the medical professional who goes through and makes sure that all the other possible causes of behavior problem are ruled out. There's often some sort of clinical interview where information is obtained from both the parents and the child about the child's physical, physiological characteristics. And then often the parents, the teachers, and sometimes even the children complete behavioral rating scales. The ones that you see the most often are the Connors rating scales. And those are done on a Likert type scale where students are ranked in order from 1 to 4 depending on their impulsivity or their attention or lack thereof. Although we do have statistics on how many students who are under the OHI label, under the OHI category, are in special education classes or general education classes, we don't necessarily have the breakdown of students with ADHD because it's embedded in that federal disability category or it coexists with other disabilities. But I think it's pretty safe to assume that students with ADHD are receiving some, if not all, of their education in a general education classroom. These students who do not qualify because there's not a large educational impact may receive services under a 504. So remember, 504s come under the American Disabilities Act. And because a student has a disability of ADHD, then they are protected under the ADA laws. So even though they can't receive special education services because there's not enough of an educational impact, they could receive some supports to help them access school or the instruction. There is a video that goes along with this to talk about strategies to help students with ADHD in school. So instructionally, when you're talking about a student with ADHD, some considerations include functional behavior assessments and behavior intervention plans, coming up with a way to assist students with replacement behaviors. So if a student is impulsive, teaching them new behaviors to help them throughout their school day. Oftentimes self-regulation and monitoring is part of that, helping as students learn to monitor their own behaviors and to think about their decisions before they act on it. A lot of homeschool collaboration and discussion is also important because often, again, these students are very disorganized, so it's important to have those conversations with the parents so that the student is on the right track. There may be a need for some instructional modifications. And then last, which is a parent decision, is the stimulant medication. It's important to understand when we talk about educational considerations that it is not our job as teachers to suggest or influence or direct parents to having their child medicated. And what's important to remember on this topic is that if you are in a meeting, in an IEP meeting, in a meeting with a parent, and you say to the parent, as the professional in the room representing the school district, It would be a good idea for you to get your child to the doctor and have them medicated. The school and you and the division are now financially responsible for having that appointment and getting that done. So you want to be very delicate when you talk about medication and medical services. You can certainly say something like, have you spoken to your doctor about this? Had they talked to you about any options? Those are good questions to ask, but you don't want to propose that a child get medication, and really we're not doctors, so that's really not our place. There are 2 videos for you to watch that are kind of fun, but it gives you an idea of how difficult it is for some students to pay attention to the right things as they go about their day at school. Now that we've kind of laid out what we can and can't say about medication, it is important to realize that some of your students may take medication either before school or at home. And this just gives you a rundown of some of the most common types, so that if you have a parent who says, my child is on Adderall, you know essentially what it is and its duration of effectiveness. I think the duration of effectiveness is most important as a teacher, because we may have students who come in the morning and they may have just taken their medication and then come in and take it again if it's not a slow release at lunchtime. So you can expect to see the behaviors peak right before lunchtime and again right at the end of the day. So just be cognizant of the fact that some students who take medication are not always going to feel the effects of it if it's not a slow release and it's kind of wearing off as the day progresses. One of the challenges with ADHD is that we use rating scales. We use a lot of observations. So a diagnosis may really reflect the biases of the evaluators. If you are from a particular culture or have certain beliefs that children are meant to sit for long periods of time and should not be moving, your tolerance for children who are wiggly and inattentive and disruptive are going to be low. If you are from a culture where children are meant to be up and rowdy, particularly boys in some cultures, then your expectations are going to be low, and so you may not see some of the characteristics as problematic. So just be aware that identifying students with ADHD in some cultures and some diverse backgrounds can be challenging. Moving on to emotional behavioral disabilities or disorders, the federal definition still uses the word disturbance, and it's a condition exhibiting one or more of the following characteristics over a long period of time and to a marked degree that adversely affects a child's educational performance. So you can see this inability to learn that's not because of another factor, so not because of a learning disability, inability to have interpersonal peer relationships, having inappropriate behavior or feelings, that pervasive mood of depression or unhappiness, and then the tendency to develop physical symptoms or fears. So just one or more of any of those. When defining EBD, a couple things to take into consideration. Frequently, you're going to see a number of dimensions that are used pretty commonly to describe behaviors. One is going to be the frequency of the occurrence. So if the child is having meltdowns, let's use meltdowns as our example, the frequency might be once a day or once a week or twice a day. So oftentimes you'll see that as one way to define the behavior, in addition to the intensity or severity. So they have meltdowns once a week to the point of being unable to talk to adults or complete their work, and then duration for upwards of 45 minutes. And then the age appropriateness of the behavior, you can discuss how that compares to same age peers who may be having similar issues. So all of those components come into play as you're kind of developing descriptors of behaviors that are associated with EBD. The other thing that is important to understand when you're defining emotional behavioral disorders is the difference between labeling a child as disturbed and seeing the child engage in disturbing behavior. I think that we can all recognize that we do some things that may be stupid sometimes,